Hi, my name is Danny and I'm a student nurse. This is my instructor, Joy, and she is going to be watching me while I perform a head to toe assessment on you. Is that okay?
Yes.
Can I see your wristband? Can you tell me your name and your date of birth?
Falana, 11/16/1995.
Do you know what year it is?
2020.
Do you know who the president is?
Joe Biden.
Do you know where you're at?
Yes, I do.
Okay. So I am going to give the patient privacy and make sure I do proper hand hygiene. I'm going to be checking for IVs, no NG tubes, make sure all the equipment is working properly. And then I'm going to take your vitals, okay? Patient's blood pressure is 100/60. My patient is alert times 4, and her respiratory rate is 14. And then I'm gonna be checking your radial pulse. Patient's pulse is at 62. And then I am gonna do hand hygiene again before I start my head to toe assessment. And then when I start my head to toe assessment, I'm gonna be starting at the head, checking the scalp for any cuts, abrasions, head lice. I'm finding no cuts, no redness, no swelling, no head lice. And then I'm gonna be checking the patient's ears for any drainage, any redness, any swelling, and I'm gonna be checking both ears. So there's no redness, no swelling, no signs of ear infection or anything like that, no cuts. Uh, and then can you actually follow my pen light without moving your head and just your eyes? And then can you look straight up at the ceiling? I'm going to be checking the patient's pupils to see if they interact with the light. Patient's eyes are perla and her sclera is white. And then I'm going to be moving down to the nose to see if there's any drainage, any swelling, any cuts. and to check if the septum is straight. If it's not, she could have trouble breathing. And then, can you say all for me? I'm gonna be checking her mouth for any canker sores, any swelling in her gums, any redness. It looks like there's no swelling, no redness in her gums, no cuts, no canker sores, no swelling. And then I'm going to be checking the back of her neck. Make sure both sides are even. There's no swelling. And then I'm going to be moving down to her shoulders. And then down her arms. And then I'm going to check the cap refills in her fingers. They are less than 3 seconds. Can you lift your arms up for me? And can you put them back down? Can you lift your head off of the bed? You can put it back down. Her upper extremities are ×4. Actually, one more. Can you look left? And can you look right? Now her upper extremities are ×4. Okay, and then we're gonna do another test with your hands. Okay, so I'm gonna pull on your hands. Try not to let me pull. Now we're gonna do the opposite. I'm gonna push. Okay, push back. Alright, and then I'm gonna be listening to her lung sounds. 8 in the front, 10 in the back. Can you breathe in for me? Deep breaths. Again. 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 Last time. Alright, can you sit up for me, please? Now I'm going to be listening 10 times in her back for her lungs. Can you breathe in for me? You can lay back down. So what we were listening for was any crackling or wheezing in her lungs, and we didn't hear any of that from the front or the back. And then I'm gonna be listening to her heart sounds. We're gonna be starting from the aortic, and then we're gonna move to the pulmonic, then to the tricuspid, then to the mitral. So for the mitral valve, we're gonna be listening to it with the bell of the stethoscope, and we're gonna be listening to it for 1 minute. We didn't hear any murmurs in her heart sounds. Um, we got the lub dub sounds from the S1 and S2, and then we're gonna be moving on to her abdomen. We're gonna be listening to her bowel movement, starting from the left lower quadrant to the left upper quadrant to the right upper quadrant, then to the right lower quadrant. So it doesn't sound like much in there. Have you eaten today?
No.
Do you have any problems going to the restroom?
No.
Do you remember the last time you ate?
Yesterday?
Yesterday? Do you remember your last bowel movement?
This morning?
Okay. And then we're gonna be looking at her stomach to see if there's any distension in it. And then we're gonna palpate and auscultate her abdomen. And then we're gonna move on to her lower extremities. So we're gonna be checking her skin is warm to touch, and I'm gonna be removing one of your socks. Okay. So we are gonna check the cap refills in her feet. It is less than 3 seconds. I'm gonna have you bend your knee for me. And your other one. And we're gonna do the same thing as we did with your hands, okay? So push towards you as I'm pulling backwards. Now the other way. Push. And we're gonna check the Homan sign. There is no sign of it. Her Homan sign is negative. Then we're just gonna put the sock back on you. All extremities are full range of motion. We are gonna raise the bed back up to a more, or lower it to a more comfortable position. We're gonna leave the call light in reach for the patient. And yeah, that's about it for the head to toe assessment.